It's one of the unfortunate facts of life. If you live long enough, you will eventually be faced with cataracts clouding your vision. The doctors at Vance Thompson Vision know how important it is to see your life clearly, which is why they are world leaders in cataract and advanced cataract surgery. We recently sat down with Dr. Vance Thompson to find out how the group is able to offer world-class cataract care close to home. Thanks so much for joining us today, Dr. Vance Thompson.
Thank you for having me.
We're talking about cataracts, so can you just start by explaining to us what exactly a cataract is?
You bet. Well, really, there's two focusing elements in our eye. The front window is the cornea, and that's the focusing element in front of the pupil. The focusing element behind the pupil is our lens, and it has a couple really important functions. One is it provides a third of the focus power of the eye, but the other is it provides variable focus, so that when we look at a distance it's flat, and when we look up close it zooms in to read. That's why I like to call it the reading lens. And the first thing that goes wrong with it in our 40s is that it starts to get stiff enough that people aren't reading as good as they used to, and then they need either reading glasses if they were born with perfect vision, or they need readers in their glasses, bifocals, if they're wearing glasses. And so the second thing that goes wrong with the lens is it eventually gets cloudy, and we call that a cataract. So a cataract is a clouding of our natural lens.
So basically our vision gets kind of blurry, and is that the main sign for having a cataract?
Yeah, and it kind of just sneaks up on someone. They might have trouble, with reading even with bifocals or reading glasses. They may notice nighttime glare, or they're not seeing the signs like they used to. Or if they're in the back row of a playhouse or at church or in an auditorium, they may not see the details like they used to, and they think that they just need a glasses change or something. And they go in to get an exam by their optometrist or their ophthalmologist, and the glasses just aren't, they can't give them the image quality they're looking for, and they're probably looking at cataracts are now the cause of blur.
So who is at risk for cataracts?
Well, basically, cataracts are kind of a fact of life. If you live long enough, you get them. I like to say cataracts are kind of like wrinkly skin and gray hair. They happen with age. And our natural lens that is crystal clear in our younger years, it starts to get yellower. And that really starts in the 50s and sometimes even younger. And so it really eventually happens to everybody.
So how can cataract diagnosis vary between patients?
Well, the cataract growth is real variable. Just because you hear the word cataract doesn't mean you need to have cataract surgery. This is something that is only important if it's affecting your vision. And some studies say 30% of people need cataract surgery, some people say 40%. But it really gets down to at what age you get the cataract and how active your life is. If you're an accountant or someone working on small things, or you're a pilot, you're probably going to need cataract surgery at an earlier stage. If you're someone who is retired and maybe not doing intense professional activities, you may be real satisfied with your vision and you don't need cataract surgery yet. So it's really variable who needs it, and it's based on your visual joy.
So cataract surgery, what are the latest options for having this surgery done?
Well, basically the cataract sits again behind the pupil in a capsule that's as thin as saran wrap. And we take off the front of that capsule, take out the cataract, and then we need to replace that lens, our natural cloudy lens, with a clear artificial lens. We call it a lens implant. And I think where research has really progressed is in some of the technologies that have been developed to make cataract surgery safer and more accurate, and then also the implant options, because it used to be that you could just replace the clarity and you would be putting in the lens that gives you the near vision of an older person, and you would be pretty much guaranteed bifocals or trifocals. Well, now there's lens implants that replace both the clarity and the reading ability that we lost before we were in our 40s. And so it's real exciting for cataract patients when they learn that You mean after cataract surgery I could really be able to get by without glasses and I'd be able to have my reading restored? I thought it was just going to be the clarity. So you really want to do your research, and you want to understand the methods used in cataract surgery and some of the techniques that have been developed. And you want to understand your implant options and decide what sort of vision do you want. And I basically say to a patient, after cataract surgery, do you want to do a lot with glasses, or do you want to do a lot without glasses? Because there's both ways. Both ways work great. It's just a matter of what you want in your life.
Personal preference.
Personal preference.
So let's talk about the recovery process now after cataract surgery. What does that look like?
Well, typically with cataract surgery, you come in on the day of surgery, you're there for 2 or 3 hours. The procedure itself takes 8 to 10 minutes, sometimes 15. It's usually with light anesthesia. You don't have to be put to sleep for it. We like people relaxed but awake but comfortable. And then a lot of people are back to work the next day after an eye checkup in the morning.
So why is it important for patients to get these cataracts fixed right away and checked out rather than wait?
If you have blur and you are starting to not enjoy nighttime driving, or you're not seeing the faces of people from a distance and you're starting to get frustrated with your reading or something like that, then it's worth looking into cataract surgery. It's the most commonly performed surgery in medicine in the world. It's one of the most successful surgeries known to man. So if you're frustrated with your vision, it's definitely worth looking into. But if you hear the word cataract and you're not frustrated with your vision, it's okay to say, I'm going to see how I'm doing a year down the road. And because cataracts aren't going to hurt the eye, and waiting is not going to hurt your outcome. I recommend cataract surgery when it's affecting someone's joy in life, their vision, and they want it to be better.
All right, lots of great information today, Dr. Vance Thompson. Thanks for sharing that with us.
Thank you for having me.
If you'd like to find out whether a cataract procedure could give you back clear vision and better night vision, or you want to schedule an appointment to find out whether you could be experiencing the signs of cataracts, call them in Sioux Falls at 605-361-3937 or visit their website at vancethompsonvision.com. KELOLAND Living viewers will find a free cataract checklist at siouxfalls.vancethompsonvision.com, or you can give them a call. Their dedicated team of skilled professionals will be happy to talk with you about options for paying for surgery and getting an evaluation. You'll also find the answers to frequently asked questions about cataract online as well. Be sure and tell them you heard about it on KELOLAND Living.